Welcome back. We're here today with a cracked tooth, number 18. We're going to use Sericimtil zirconia to restore. It's very typical for my office. But let's look at our pre-op and see what we can see. So, patient has a large mesial occlusal existing restoration. Not a whole lot else you can really tell from this image. But when we're chewing on this tooth, we're eliciting a sharp pain upon biting something hard or heavy that goes away quickly. Cone beam shows the nerve is vital. That was confirmed with an endo-ice test where the patient could feel the cold and it went away pretty quickly within like 5-10 seconds. So diagnosis, cracked tooth syndrome. The suggestion is let's put a crown on this. We're going to wrap it all the way around and on top, help hold it together, prevent further propagation of that crack. So we'll start with our cut tool to get rid of our junk data, things that we don't need to do our job. Junk data is gone. Maxillum. Can imagine if that cheek was included, this cheek on the backside here, we would get some funny proposals because it's going to try and avoid that for occlusion. And of course, the cheek moves out of the way. So we don't really need to consider it while we're formulating our crown. Okay. Model axis will get lined up. It's good. Set jawline, just taking this blue dot, putting it in the center. Go. And then next we'll draw our margin. So I like to do this twice. The first time around, I don't really care where it goes. Doesn't really matter. We're just drawing a circle around the tooth. The second time will be more particular. Make sure we get this thing exactly where we want it. Okay. Looks nice. Our insertion axis is the direction in which the crown will seat. I like to make that parallel to the long axis of the neighboring tooth. We'll apply that view direction, check for undercuts. Small undercut there, not worried about that. It's minor. Spacer, 120 microns for bonding. We like to bond here because that keeps the crown on more securely. Generating a proposal. Here is our initial. Looks like we're going to be a little tight right here. Let's put the upper jaw on. We can use our form remove tool to get rid of this. Looks like we do have enough clearance, so that is good. The reason I know that is because the double turquoise comes through, not that minimal thickness, which we're seeing here. So we can correct this. Just going to use a smooth tool. If smooth tool doesn't want to do it, we'll pull out a shape circular, usually in a groove. I like the smooth tool because it brings that groove up to smooth this little smooth yellow window that you see. But in a case where that smooth tool doesn't work, you can see there, it's just getting worse. Use this shape circular. Come down and just gently bring that up. Okay, that looks good. Let's see if we can get rid of this green. This green. There you have it. There's our occlusion on our crown. Now, sometimes I like to overlay the pre-op just to see what her bite will look like. And you can see that our new crown exists underneath her old restoration. So she shouldn't have any biting problems with this setup that we're giving her. Matter of fact, we may choose to give her a little more occlusion, like on this cusp. We've got one of the blue, well, the dark blue means we're within 1 millimeter of the opposing tooth. This lighter blue here means we have light contact. I like that double turquoise right there. We see the even lighter blue. So there's the 3 blue colors. Double turquoise, chef's kiss, in my opinion. That's going to give us just a very light contact, which is what we're here for. All right, I'm not going to bring this marginal ridge up any higher because I'm level with the tooth next door, which is where I want to be. So I'm just going to leave that where it's at. What I may try and do is reduce this occlusion a touch more. Yeah, I'm not going to be able to. Let's see. Let's see if we can smooth off this minimal thickness. Let's check this position of our upper crown. Okay, that should work nicely. So fissure height's good, occlusion's good. We're gonna check our contour next. Do we like the shape of this tooth? I would argue yes. I think that contact looks broad. I'm happy with that. We'll get rid of the other neighboring teeth and check our proximal contact. Actually looks really nice. Normally I change it just a little bit. In this case, I don't think I'm going to. I like the way that looks. Got that broad double turquoise. I've got that nice fat green part in the middle, which I like for the most distal tooth in the arch or the furthest tooth back. So I'm not even going to change that. What I will do is check what happens when our jaw moves around. So open the articulator, run the virtual articulator computation. Just an algorithm for moving jaw left, right, forward, and back. It has now generated a new tool, FGP, functionally generated path. It's this purple up here. We're going to remove some of this. This right here may have to get, may have some minimal thickness here. Let's just take this FGP away and see. Nope. Looks good. Okay. So when the patient moves her jaw around, she's not going to be bumping into my new crown. Let's appreciate what the old tooth was doing. Here you go. And this is where we can start to see why that tooth may have cracked. Because when her jaw moved around, she was really banging into these, these buccal cusps here. And that can encourage that tooth to separate. Appreciate that with the rest of the arch. Like left, right, forward, and back, she really wasn't having much interference here. But when you get to that back tooth, like she was just really beating it up there. So this, to me, this justifies why that tooth cracked and why it's going to be better with my crown. Because now you see my crown exists under that plane. So she's not going to be beating that tooth up, even though she's got a nice bite when she's just straight up and down. So that should work well. All right, we are ready to produce.